we have a patient who's unhappy with his jaw, and you see the lower jaw without him opening the mouth. You see it is protruded outside. That is because he has a he has a scaphoplast plate. See an open bite there, an underbite rather. His upper teeth are inward. That is because his jaw is inward. It is retruded. What we call a maxillary retrognathism, and what we intend to do is a LiFO1 advancement by about 4 to 5 mm and a BSSO setback with rotation. That is the surgical plan for him. So we are going to bring the upper jaw forward, we are going to bring the lower jaw backward, and we're going to rotate a bit. I say rotation because smile button. So his central incisors, his midline is not matching, and that is why he needs a rotation too. So this is going to be a bimaxillary surgery that is involving both the jaws. Both the jaws will be osteotomized, and this surgery is going to be performed from inside the mouth. So patient will be only having resorbable sutures which will be placed at the end of the surgery. So he doesn't have to worry about any scar. Although the anesthesia, the intubation would be transmyloid, so he'll be having a small scar here, but those sutures will be removed on day 5. So overall, post-op, we will be following up with this patient. He'll be on a liquid diet for 5 days at least, and as days pass by, we are going to monitor swelling, pain, and we'll show you how the post-op recovery phases.
That is there, but this needs to be rotated, right? The teeth are like that, I think. All right. Okay. Some asymmetry with the upper as well. So what you're seeing is a patient who has issues with his jaws. You can see that he's got an underbite, but apart from that, he also has asymmetry. We're planning a bijaw surgery for him. We're going to get the upper jaw forwards. We're going to rotate the backward, the lower jaw a little bit backwards as well, and also rotate it. You see, this angle is not nice. It's a straight line almost, and we're going to make it about 110 degrees, something like this. His chin is a little bit too strong. This is inside, so we're going to get this part projected. And when I'm doing that, we're going to work on the nasal base and reduce the width of the nose here, which is possible. Get the fullness to the upper lip. Get this part also full. It's going to come out. Obviously, the dentition, the bite is going to be fixed at the same time. And we're going to be doing a similar thing on this side with the angle. So that's the plan, bijaw. The anesthesia we will give through submental region, so we can work on both the upper and the lower jaw, and also the piriform rim, so that we can take care of it all in one go. It's going to be with us for maybe 4 or 5 days. We've already done the mock surgery. We've got the splints ready. He's good to go for surgery. Before and after, this guy's got facial asymmetry, underbite. We fixed all of that by means of a bijaw surgery. We made his face more proportional, his jaws in the right position. I'm going to show you one by one now. I'm going to show you how his face looked in the side view. So that was a side view. You can see the improvement. Bi-jaw for this guy now. A bi-jaw is a surgery when you do surgery, a jaw surgery on both the upper and the lower jaws. This is only 5 days after we've done the bi-jaw. So there's still going to be a lot of swelling. His occlusion is still going to take some time to settle down. We're going to take these splints off and I'm going to show you the comparison and the changes that we've brought about. One moment. Right. First up, I'm going to show you some scar here. It's like a less than centimeter small incision that we placed to give him anesthesia, which is actually causing him a little bit of a swelling on this side. Chiricho, show your teeth. Yeah, so you can see his upper teeth in the right position now. It was way behind here, underbite, with this lower jaw sticking out. Right, side view. You can see that. Okay. So look at that. You got it. That's clear for you all now. So this is surgery first approach, guys, because we're doing the surgery first and then he would go for braces if he needs. And I keep mentioning that not all our patients need to go for braces. He may not need braces as he looks. Our orthodontist and the dental team will evaluate him and they'll make a call on his dental procedures later on. But that's how he looks immediately 5 days after surgery. I'm going to show you different views now, side views. So you can see that. So we've done work on the angle. He had one straight line there. Now he's got a nice angle, as you can see. So that's one thing. His lip is in the right position. He's got a nice mentolabial grooving now. This chin was straight and the upper jaw is inside. You saw the, again, this is the other view. This is the upper view. What about the other side? Do we have pictures on the other side? Yeah. So you can have here. Again, you can see the similar thing. One straight line. And now he has the angle that you can already see. And then you can see this nice grooving here. Reduction in the height of the chin. We've made it more proportional. The upper jaws come outside. It's good fullness here. So this is what a bi-jaw does. You know, we can move the upper jaw forwards. We can rotate it in either the clockwise or the anti-clockwise fashion and do a similar movements of the lower jaw. Why are we doing all these movements? We're doing all these movements to get the jaws in the right position so that patients are able to speak well, chew well, breathe well, sleep well, and most importantly, augment the facial proportions and ratios and does increase their facial aesthetics. All right, so he's going to go back home. He's not from very far away, he's from nearby. And follow us up with our orthodontist and our dental team.